And welcome back. Senate Deputy Leader Michael Gianaris and Assemblymember Karines Reyes have recently announced the New York Health and Essential Rights Act. The critical bill also requires businesses to have enforceable safety standards to prevent further spread of the coronavirus. The New York HERO Act would require the Departments of Labor and Health to implement enforceable minimal standards for workplace safety. The regulations must include protocols on testing, PPE, social distancing, hand hygiene, as well as disinfection and engineering controls. The question is, what can we expect moving forward? Here now to share a little bit more on the details is the District 87 Assembly Member, Karines Reyes. And Assemblywoman Reyes, good to have you here and back here on Open.
Hi, Darren. Happy to be back. Good to see you.
Thank you. So walk us through a little bit of this here, because of course you yourself, and first of all, thank you for the work that you've done on the front lines, literally not just as an elected official, but literally working in the hospitals for during this time of coronavirus. But I know this is a bill that really is very special to you. So share with us what you're hoping to accomplish through this.
Yeah, so the reality is that this bill creates airborne precautions for all industries and all workplaces. And the reality is that unless you work in a healthcare setting, you don't have any health and safety standards around airborne infectious diseases. And the reality is that through COVID-19, we've seen kind of like a haphazard response from the state and from the federal government as to what should be the precautions that businesses should take to reopen safely, to protect their workers, to protect the customers and the overall community. So because there aren't any standards in place, it's just CDC guidelines and people apply them however they see fit. We believe that to be proactive and to protect not just the safety of workers, essential workers, but the overall community and customers, that we should have moving forward airborne precaution health and safety standards that businesses can apply to their individual industries. The bill also creates worker committees, which allows the actual workers to provide input into what those precautions will be and how they will be implemented in their individual workplaces. And it also creates an enforcement mechanism, because the reality is that currently with the CDC guidelines, there is no way for the Department of Labor or the Department of Health to enforce precautions. And we don't know if businesses are actually providing those precautions and providing the necessary PPE for their workers and their customers.
We've heard from business owners, and we've talked to people in business improvement districts a little bit about the challenges for business owners. Some people already feel overwhelmed because of the loss of business. Others say, listen, you know what, we're trying to just get our business back, having the necessary funds for PPE supplies and stuff like that. So talk to us about, if you're a business owner, is there any assistance that's available in helping business owners to be able to have the necessary supplies so they don't end up on the wrong side of this legislation?
Yeah, so currently the legislation just talks about the standards, but that's definitely something that we could talk about moving forward, because once those standards are implemented, then we could create a mechanism for the state to be able to provide that PPE or make it more accessible for them. But I know for some businesses, and this is what we've heard back, in some industries, they find this to be an unnecessary burden. But the reality is that not every employer is a good actor. We're going to have people who are going to cut corners, and by doing so, are going to put people's lives on the line. So we want to create the standards. And if you're a business that's been following the rules and doing everything that you can to keep your workers safe and customers safe and the community safe, then by all means, you're going to be fine, right? But if you are an industry or an employer who unfortunately hasn't been doing everything possible to keep people safe, then this is going to feel like a new burden on you. But the reality is that we can't cut corners when we're talking about people's lives.
Yeah. Let's switch fronts for a minute. New York State Governor Andrew Cuomo did make a recent allocation talking about $90.4 million in state funding awarded to 20 projects to house New Yorkers who are experiencing or at risk of homelessness. We know that homelessness is a big issue here in the borough, supportive housing, a big issue in the borough. Do you feel as though this will be a benefit, if you will, to Bronxites?
I mean, any cent that comes to the Bronx is helpful. Unfortunately, that number is not enough. And it's not a number that we think is sufficient to address the needs of supportive housing, homelessness that we're facing currently. We are in the process of putting together the state budget. The governor presented his executive budget We just last week finished reviewing all aspects of it, and we're in the process of putting together our one house budget. The Senate puts together their budget, and by April we're expected to pass what is a state budget. Granted, the executive budget had significant cuts across the board to supportive housing and a lot of supportive projects and services, social services that our community benefits from, but even more so now with the deep need that we've seen post-COVID or during COVID, with loss of income, loss of employment, remote learning, all the need for social services. And the governor has done an across the board 5% cut on everything. So we are relying on not just money that's going to be coming from the federal government, but also revenue raising measures. We believe that it is time for us to raise taxes on some of the top earners in our state. We've seen millionaires and billionaires exponentially increase their wealth during COVID when so many people in our communities have been suffering. So it is time for us to equalize our tax structure and have them pay a little bit more. And that would be a way for us to fully fund all the services and social services that we need, including programs for supportive housing and building new supportive housing, and making sure that we fund education and fund healthcare and not make cuts to Medicaid at a time when so many people are relying on it.
Are you satisfied with the rent moratorium, the fact that you cannot see evictions for a longer period of time? Obviously, a lot of people in your community have a lot to deal with rent and renting apartments. Are you satisfied with the pushback as far as the moratorium?
Well, I'm not completely satisfied. So I was the author of the blanketed moratorium bill that got chopped up and turned into a huge omnibus piece of legislation. But my original bill had a moratorium that extended for a year after the emergency order was lifted. And that bill was also coupled with another piece of legislation that would create a fund to pay for back owed rent. So we are currently in the process. So the current eviction moratorium only is extended to May 1st. And perhaps at that time we'll have to revisit whether another eviction moratorium is going to be needed, depending on what the current situation looks like. But also we realize that we can't just stop evictions and not address the issue of back owed rent. Particularly for landlords, we understand that landlords also have to maintain their properties, pay taxes, pay utilities. So we want to make sure that we create a fund where landlords can access those monies of back rent. And we want to be able to make sure that we make them whole and that people are no longer owing rent once the eviction moratorium is lifted. Because what we don't want to have is a huge wave of evictions after May 1st.
Yeah. Last question before I throw out of here is to ask you a little bit about CUNY. I know that there's legislation and a plan in place to really assist CUNY students. You've been at the forefront of that. Let's talk about that for a second.
Yeah, so I introduced a piece of legislation along with Senator Andrew Gennardis that would create a new deal essentially for CUNY. It is a $1.47 billion investment over 5 years that would create tuition-free CUNY for New York City residents, and it would pay for more professors, for more mental health counselors, and for more social workers and counselors overall. So we want to not just eliminate tuition like it was before 1975, because my dad always talks about when CUNY was free. But also make sure that we have the staff necessary to address the growing needs of our student body. And
are you optimistic about it moving forward?
I am optimistic. It looks like there is a significant infusion of money coming from the federal government that's earmarked for CUNY. And like I said, if we're able to raise revenue along with this money, I am optimistic that this is something that could get done this year.
All right. And what about the state budget before we leave? You guys are working on it, optimistic it'll be on time?
This year is unprecedented. And I think that we have a lot of people and not necessarily willing to compromise on the important things. And I think that may mean that we may not pass an on-time budget.
Well, we'll continue to follow and see what happens. Assemblywoman Karines Reyes, thank you for being with us here on Open, and best wishes to you. And thank you again for the work that you're doing. I can't leave without asking this. Talk to us and give us an update. I mean, your front lines in the hospital. You work in the hospital system. Bronx has been the highest hit of all the boroughs as far as COVID. Give us an inside look as to what you're seeing.
Yeah, so it's definitely not what it was back in March and the spring and early summer. We did see an increased number in hospitalizations right after the holidays, right after Thanksgiving. I was there, and I was there over December and the Christmas break. But it's definitely nothing like it was back in March. So the numbers are decreasing. People are still sticking to the precautions of social distancing and wearing masks and washing their hands. But what we saw that when we saw that spike, it was directly correlated to behavior, right? People congregating for the holidays, eating together, spending time together, and not sticking to those social norms, the social distancing and those precautions. And we saw those spikes. So we want to make sure that people continue to take those precautions moving forward.
All right. Someone, Karines Reyes, we'll leave it there. Thank you so much for joining us here on Open. And again, thanks for your work.
Thank you, Daren.
All righty. We want you to stay tuned because guess what? We do have more Open. Don't go anywhere. Open will return coming up right after this.